it's really a pleasure to be here. I'm so excited about the center and where it's going and what Jan and Richard and other people are doing, and I'm happy to be even a small part of it. And it's really nice to be here because I feel like I've been on Zooms for a whole year, looking at Oxford from Zooms, and here I am. And it's in a lovely college setting as well. So, okay, so some of what I'm going to say is just very quick background, which won't be that new to many of you, but it's how we've been using well-being metrics to track deaths of despair and sort of where that's leading. But the thing I really wanted to talk about most and get feedback about most, which is really, I have to say, it's kind of out there work, but it's surveys of hope, because I don't think we can talk about solving despair if we don't understand why do some groups, cohorts have hope and others don't, and can we learn from hopeful poor minorities for the desperate, in the US, for the desperate, less than college educated whites that are really becoming, as I said, a really worrisome group. So that survey, I did the first set of surveys with Julia Risposuelo, who's here doing her DPhil in psychiatry now. And we did surveys in Peru, and we were able to do a follow-up right before COVID hit. So we have 2 rounds of interviews 3 years apart, so we could actually see how our hopeful adolescents were doing 3 years later. And then I've been fielding it in low-income Missouri. Now, Missouri is in the heartland of the US, and it has every problem that the US has. They have rural poverty, they have urban blight, they have sort of Black gangs and crime in the city, got a lot of gun violence. They have white rural poverty, they have divided politics, and they actually border on 8 other states. The state of Missouri, which is not exactly, particularly attractive or wonderful, but it borders on 8 other states. So it really is sort of a microcosm of the middle of the US. And the results of those surveys are just trickling in. I want to tell you a little bit about what we're finding, but also we're going to have a chance to repeat the survey in a year or 2. So it would be any kind of suggestions. We can always add new questions or try and revise what we've got while keeping the baseline the same. So that would be really helpful. Okay, so I think I was one of the first people very early on to worry about inequality of well-being and not just inequality of income. And now a lot of people have done really good work on it, much better than mine. But I've been really trying to explore why it matters, right? If you just sort of the skeptic, well, do we really care if hope is unequally distributed, or if stress is unequally distributed? And it turns out, yes, there are real consequences, and we're seeing them. We also know that optimistic people live longer, they're more productive, and we know that the desperate people, are dying prematurely in the US, and there's some of it in the UK, nothing like on the scale here, and some of it in some other European countries. But we know that people in despair not only are more likely to die early of self-imposed causes, but they're also much more likely to vote, to be vulnerable to extremist voting and other kinds of radicalization. And I think those are problems that we are, again, the US is probably the most extreme, but a lot of deindustrializing countries with deindustrializing, big deindustrializing sectors have that problem. So one of the things that, looking back historically at what happened to optimism in the US, is realizing that if we'd been tracking well-being like you all do here over time, we would have noticed that optimism started to fall among less than college educated white males in the 1970s. The deaths of despair came around the year 2000. So 2 decades before, we see this big drop in optimism among less than college educated white males. What's going on? Nobody asked, because we didn't know till we looked back into the PSID data and noted also that at the same time, African Americans and women got much more optimistic as gender rights and civil rights improved. And so the trends we're seeing today, we would have known about them 30 years ago if we followed well-being trends in official statistics, something that Jan also very helpfully pointed out in our workshop about the need for publicly available national statistics on well-being, which the US does not have. And then the other thing is that we've done a lot of work matching the patterns in the metrics, mainly stress and worry on the one hand and optimism or despair on the other, at the level of individual, race, and place, and finding that they match very robustly with the patterns in deaths of despair. So these could have been warning indicators. So not only is it, in my view, is it important to think of well-being as, an positive objective we should have, but it's also a way to take society's temperature on a regular basis and notice when somebody has a fever, and that can be an age group. I mean, right now the COVID data is telling us that young people are suffering more than they have in the past, and their potential issue. I'll talk a little bit more about how complex the deaths of despair issue has gotten in the US over the past year, and not in a good way, and reaching new cohorts. So COVID obviously has been a hit on a pre-existing crisis. I'm not going to talk about how we measure well-being because we all know that. Here's the famous U-curve in happiness or life satisfaction. The only reason to note this is that until about 2 years ago, the despair was concentrated very much among middle-aged less than college-educated whites. If you look at the US, something Lucia knows, I think, well, and others, that reported pain in the US poses a huge puzzle. So in most countries, you see reported pain go up as people get older. It just makes sense. Older people are more likely to have mobility problems, to get injured, whatever. And so typically you see an almost linear relationship with age and pain. But in the US, there's a cohort effect. And what we're seeing is this now, the middle-aged of today report more pain in the US on a daily basis than do older people. The US reports more pain per capita than 30 other countries, many of whom are less wealthy than we are. And I think one big reason is that I think that's psychological pain, because often, we find that typically you would think pain would be higher for manual laborers and miners, and those are all industries that no longer exist, and yet that's where you're still seeing a concentration of reported pain. So it could easily be psychological as well as physical pain. So here's just to remind people that there are these big gaps in optimism between these are just low-income groups, and the gap is biggest between low-income Blacks and low-income whites. So low-income Blacks are almost 3 times as likely to be higher up on a 0 to 10 life satisfaction in future or optimism scale. We found this holds not just for the Cantrell ladder and the future question, but other measures of optimism. And they're also much less likely to report stress on a daily basis than our low-income African Americans. African Americans in general are more optimistic than whites in general, but the gap between, say, rich whites and rich African Americans is much, much smaller than at the low-income level. And again, reported stress follows similar patterns, although some differences with COVID that I will show you in a second. So the classic pattern in deaths of despair was that you see the deaths of despair start going up around the year 2005 in the US. That red line is US whites, but if you look down in the middle, the thick blue line is US Hispanics, who are going down in terms of mortality rates with other rich countries. If you had African Americans, you would also see that. That progress has been reversed in the past 2 years, which is really, so African Americans and Hispanics have lost almost 2 years of life expectancy since the COVID pandemic, because they got hit so much harder than other groups by the pandemic for reasons I'm happy to discuss after. So what we're finding, I'm working on a project now with the Meadows Mental Health Institute on complexifying deaths of despair and trying to understand how there are a lot of deaths of despair, or precursors to deaths of despair, that aren't reported as deaths of despair, but they're fairly widespread. And they often have to do with kind of prolonged deprivation or prolonged unemployment or prolonged. So it's sort of showing that prior to the point where people actually die of suicide or opioid overdose, there are a lot of signs of different illnesses. But also the trend that I find particularly tragic is that in the past 2 years, we're seeing many, many more urban men, Black men, die of deaths of despair. It has to do, I think, two reasons. One is COVID and the strain it's put on the African American population, but the other is really fentanyl, which is just a very lethal opioid derivative, and people don't even know what they're getting because it's black market. And so people, it's very hard, like people say, oh, well, what a puzzle. Suicide went up a little bit during COVID in the US and then went down to below 2019 rates. But overdoses went up by 30%, from 70,000 to 93,000 in 1 year. And we don't really know how many overdose deaths are intentional or not. So they could be suicide, they could not be suicide. It's a messy thing to disentangle. But so at a much higher rate than suicide went down, overdose deaths went up, and reaching again new populations from before. The other complexifying factor in the deaths of despair is we're seeing suicides increase among minority teens. So older teens in early 20s, not poor ones, rich ones, educated ones. So that, to me, one, it is indeed sort of a puzzle, unless you think about it as an expectations and glass ceiling effect, right? So low-income African Americans are in part so optimistic because they have to be to survive, and they built resilience over time. It's generational, it's passed on. There's some genes work that Young knows all too well that suggests that as well, and there's some other stuff I've seen since. But it may be that educated Black kids, once they get, this big goal is to go to college, right? And to go to a good college. And once they get there, they realize there's still a lot of glass ceilings and a lot of both explicit and implicit racism. That may explain part of it. It may be anxiety over what COVID is doing to labor markets. I don't know, but that's a parallel trend in a very different population. So older urban Black men were often crack addicts before, and they're getting fentanyl. So it's sad, but I think it's less of a puzzle than what's going on with the youth. And that's something we really need to understand better. And some of that will come out in the surveys. So as I mentioned, we've tracked the deaths of despair with matching CDC death rate data with our well-being metrics. We built a vulnerability indicator. This is nothing new that I haven't talked about before. The different trends across races, that optimism that you saw plays out to very different patterns in deaths of despair. So even though Blacks have increased their representation in deaths of despair, and even though their anxiety and reported depression rates have gone up over the past year for obvious reasons, they started from a much, much lower level. So their rate of increase has been higher than that of whites during COVID, but they still haven't reached the level of whites. And we've also built, we're starting in this vulnerability indicator we've built, we've added in COVID data and first responder data so we can estimate what's going on with the deaths, because CDC hasn't released its 2020 data yet. CDC works very slowly, very methodically, I guess, or maybe inefficiently, who knows? But I think the latter. But so we've been using CDC, the EMS data, the first responder data, the Hopkins COVID tracker, and some new bits and pieces of well-being data, some from a survey I did with a group at WashU, some from the Gallup panel, and now also the ShareCare, which is great because it's the old Gallup Daily, which is no longer in the hands of Gallup, and it's ShareCare is a company. So I sold my soul to get it. No, I didn't. I just said I'd write some paper with them. Who knows when I'll do, but so they're getting me the data, which is great because now we'll have the equivalent of the Gallup Daily data that for 2019 and 2020, which is what Gallup is missing. The panel they did a little small panel. It's very.
Have they stopped in 2020? ShareCare? Did we continue?
No, they'll have 2021. They just don't have it yet. Yeah. No, so that's going to fill a big gap. So this is the last sort of background thing. One of the things we just did and published in Social Science and Medicine is a new paper on the plight of prime age workers out of the labor force, with a particular focus on white males because they are the ones with the worst markers. Their well-being markers are terrible. So prime age males out of all labor market groups they have the least hope, the most despair, the worst objective health indicators, high levels of opioid use and addiction, terrible objective health conditions, everything from diabetes to obesity and smoking. And one of the things we found that's a new twist on, there's been a lot of debate over the puzzle of declining mobility, geographic mobility. In the US, it used to be you moved to where the jobs were. That was part of the whole American dream story. But mobility has been falling over the past 2 decades at a pretty significant rate. We found that these prime-age males out of the labor force, unlike prime-age women out of the labor force, aren't really happy and they're not glamorous jobs, but they're usually caretakers. They have a reason to get up out of bed every morning. But the prime-age males out of the labor force are disproportionately living in their parents' homes or basements as adults or in their parents' census tracts. They're much more likely to than any other group. And they tend to live in these kind of declining places in the heartland. And they're so that between the drug problems, their health problems, and their absolute lack of any aspirations for the future, all of the programs we have in the US for trying to address problems like out of labor force are moving to opportunity, investing in these, a bit like leveling up, trying to make places that are declining into better places to live, and that means getting jobs there. These guys wouldn't go across the street if you put a moving to opportunities, sign across the street and said, "Hey, come here, you can sign up for jobs." It's just, so it's a very, very worrisome group. Again, with all kinds of implications for our mortality rates, for our politics, and for our well-being. Again, place matters. I want to show 2 more slides, 1 more slide, and then talk about the surveys. So this is just simply showing you what happened with overdose deaths. This is the top line is 2019 to 2020, and then the other 2 lines are 2019 and 2018. And as you can see, overdoses almost doubled at the height of COVID. We estimated from this a sort of 30 to 40% increase in overdose deaths based on the first responder data. CDC released its preliminary 2020 numbers halfway about in September, and that's where we got the figure that overdose rate deaths had gone up 30% from 70K the year before to 93K in 2020. So the one thing I liked, there's nothing to like about that story, but we did find that this first responder data that we've been collecting is a pretty good tracker of actual trends. If you don't have, for some reason, we don't have the actual mortality data available. This same data shows gun violence going up quite dramatically in the US. These are mental and behavioral calls. Again, you see those go up in 2020, and that's, somebody calls and says there's somebody acting really weird on my street or in my house, or my husband's threatening to commit suicide, at a whole range of those kinds of calls. But we also have gun violence, but leading the charge is really opioid overdose. So I've talked about these before, but these are just where you can see the gap. One is life satisfaction on the left, and to the right is optimism or life satisfaction 5 years in the future. Only low-income groups, and again, you can see low-income Blacks are just much more optimistic and satisfied with their lives. This is during COVID. This is a nationally representative survey we did with WashU. And then their reported mental health is also better. Now, if you look at the trends and now the new depression screening data, anxiety, and the actual clinical screening questions, you see that Blacks have increased in their anxiety. Here, this is the average for whites not whites, this is a whole sample, I'm sorry, during COVID, and you see spikes in anxiety, often coinciding with different waves of the pandemic. And then this is Blacks, and the scales don't match exactly right, but essentially the trends for Blacks are not very different from whites anymore, or from the main sample. So we do see optimism coexisting with increases in anxiety for the African-American population throughout the pandemic. A lot is going on. It's not clear you can only blame the pandemic. We had the George Floyd protests, we had a contested election, a lot of things that made people very anxious in 2020. But the point is that these changes in anxiety are coexisting with continued reported optimism. So to our surveys, So basically, again, been thinking of hope, what makes people hopeful despite adversity? Does hope matter to future outcomes? The answer to that is yes. And we've been doing these surveys of young adults. So Hui and I started with a poor to near poor neighborhood outside Lima. When I started working there over 20 years ago, it was all dirt floors, no running water, straw matting and prefab houses. Now about half the neighborhood has running water, pavement, a health post, a metro you can walk to. It's 10-minute walk from the beginning of town, but most people walk to the metro and can go work in Lima. And then we have the other half of the population still living in these sort of no pavement, no electricity, no water situations. They tend to be the children of the people who made improvements. And so they're like the next generation trying to make it. And what we found, we surveyed 400 kids, 18 to 19 years old. And the idea with that is, one, they were over 18, so we didn't have to worry about IRB and trying to survey children. But secondly, it's an age where people are either going to finish high school and go to work or get married and do whatever, or they're going to go on and pursue higher education. So we found that 85% of our respondents in this neighborhood, if you walked around the neighborhood, you'd be scared. You don't wear jewelry there. I mean, this is not like by any means a place you go, oh my God, this is a really hopeful place. 85% of these kids said they were going to college or to post-grad, and it was an even split between the two. And you think, how can this be, right? Not one of their parents has gone to college. They're all construction workers or domestic servants that have little markets in the neighborhood, or taxi drivers. You drive the informal taxis where often the floor has a hole in it. You see the street as you go. And yet they want, and public education is free. I mean, it's decent in Peru. It's not great, but it's available. So you can do it, but you have to forego income. If you're poor, that's not that easy, right? So we were pretty surprised by this. Almost all of the high aspiration kids had had at least one or more negative shocks. They weren't sick themselves, but they might have a sick parent, or they might have been a victim of crime or robbery. You can tell there's jet lag. Victim of robbery. But we were really surprised. So when we went back 3 years later, we found that most of the high aspiration kids, over 90%, were on track to achieve their higher education goals. They were in college, on their way to whatever they were going to do. We also found, taking advantage of the panel sample, that aspirations were very persistent over time. Now, maybe 3 years isn't that long a time, but in a time in an economy that's very up and down, changing dramatically, at a time in adolescents' lives where there are just a lot of changes, it was remarkable how persistent aspirations were over time and how associated they were with other things like self-efficacy, life satisfaction, internal locus of control, the things you would expect, but it was very consistent findings. And one of the things that's key to their hope and their high education aspirations is having a mentor or supporter. So these parents who haven't been to college really want their kids to do better. And that comes out, it came out in most of the surveys, it came out doing interviews with people who knew the community, know Peru. Well, I know Peru, I'm from Peru, but it clearly, this whole idea of a mentor or supporter kind of being behind your belief in education was really critical to success. And if you think about it, many of us have grown up in situations where college was expected, right? There was no doubt that you would go to college. In fact, you'd be a failure if you didn't go to college. But these are kids who nobody in their family's gone to college, who live pretty rough lives. And yet, so to give, I think it's a question of also just giving them some sort of hope and signal that this is a really good thing to do. And it seems to be working in Peru anyway. So how about Missouri? Well, Missouri is interesting. So we interviewed in 2 school districts, one poor white, low-income white, one low-income African-American, outside St. Louis City, in the poor environments of St. Louis County. We were able to interview about 100 and some kids, split between the two. They were either high school seniors about to graduate, or they graduated in the past year. And one of the things we found was that the white kids, and they go to a predominantly white school and live in a predominantly white county in St. Louis. were much less hopeful, they had less trust of others, and they had very low education aspirations. Only one of the first batch of respondents I got, only one kid wanted to go to college. And it was a girl who was raised by a single mother medical assistant who had some college. But all the others were kids of like truck drivers or other kind of blue collar professions. And one of the things that came out in all of the surveys was that their parents didn't want them to go to college. They actively did not support them going beyond high school. I was blown away. I mean, to read this in their handwriting, you know, that their parents just really don't want them to go to college. And it's because of this kind of, the blue collar white narrative was, you go to high school, you finish high school, you have privileged access to a stable job, and that's enough. And that's how it used to be. So there was no trajectory of education being a way to get out. Life was fine then when it worked, but the jobs are gone. Minorities, for example, education has always been the way out. The same as for the Peruvian kids. If you want to live in a better neighborhood and have a better life than me, you know, taxi driver, construction worker, you've got to go to college. So it was so conditional on high school graduation. So the high school graduation rate was higher for the whites than for the blacks because it's just they're less materially deprived. But conditional on high school graduation, Black respondents are much more likely than whites to pursue college. And in my surveys, it very much came out that almost in the same way that only one white respondent wanted to go to college, only one Black respondent said they weren't going to be able to go to college. They didn't say, and with all of the high aspirations, there were the kids all wanted to go, the Black kids wanted to go to college or even post-grad. It was so weird. It's very like Peru. They had somebody, a parent or a grandparent, supporting them in their aspirations. And it wasn't always a parent. In a lot of the African-American households, there was only one parent there. It was usually the mother. The mothers were more likely to have college education than the men. I can't explain that. Sometimes it was a grandparent. There's a lot about both Hispanic and African-American extended families that holds communities and places together. But they had an active supporter of their aspirations. And meanwhile, the low-income white kids had parents who not only hadn't had the experience, or one of them had the experience, but also, I think because of how we've gotten to a point where everything's ideologized, you know, nobody believes in science or vaccines. It's sort of part of the kind of blue-collar white narrative that elected Donald Trump. And it's petrifying how deeply rooted it is. And so one of the things I also thought a lot about, you know, sort of through my interviews, and I want to know more about how to think about this and execute it, is that if you have parents that don't want you to go to college, if you have no idea what labor markets are going to look like, what 18-year-old is going to know what labor markets are going to look like in 5-10 years, they're not going to look like labor markets that will hire you if you have a high school education only. But they don't seem to be aware of that. I mean, that was really striking. Their parents don't seem to be aware of it. So it seems to me that they're not going to respond to new incentives to get educated or whatever you might think, or different kinds of skill education. They don't know that you can actually get go to community college and train in medium skill programming without a college education, but you know, some investment, and how to get a pretty decent job. They don't have a clue, but they're not getting information from anywhere. So how do you break this cycle, particularly if it's intergenerational and sort of lack of faith in education? So can interventions help provide mentors? Can interventions help provide hope? I feel as though part of it is an informational problem. I don't think it's like that whites just are naturally less optimistic than African Americans, although there are some longer term genetic differences, but some of it is just is being provincial, not being educated and not knowing, you know, never having listened to a debate about what will labor markets look like when you're 25. You know, just it's not anywhere on their radar screen, but without information, they're not going to invest in themselves.
Karen, if I may, you got 15 minutes
Okay,
left. It'd be good
that's it.
to try and.
I think I'm done. There, that was a very boring concluding slide. So yeah, we should, anyway, so I will stop. And I mean, I think, you know, obviously COVID has heightened all these problems, but also taken a big whack at the labor market for the young. So it's become even more urgent, and we're seeing that in the young people's increases in anxiety, depression. And that's not just for African-American young, it's all young people have taken, and I think here too, it's the young that are seeing like the worst.
Yeah.
Worst
Mental
well-being,
health.
yeah.
Aspiration, opportunities are less. Thank you. Sarah.
Oh, thank you.